Hi, my name is Miriam Baranchek, and my presentation is on the polio vaccine. So before we talk about the polio vaccine, I want to go over some of the history of the polio virus. So here we'll see a picture that we talk about a little bit later that is believed to be a reference to polio virus as seen in ancient Egyptian art and carvings. So for the historical timeline of the polio virus, in antiquity, there were representations of polio symptoms in Egyptian art. Also, some mummies have been discovered, such as this pharaoh Sifta, which he has a club foot, and they're not exactly sure what caused this, but they think it could potentially be polio or cerebral palsy. In 1789, Michael Underwood described polio as the debility of the lower extremities. And in 1840, polio is called the hind maiden disease, and you can see pictures of those two researchers on the right. They did great work and research on the polio virus, and this led to, in 1875, polio being named from the Greek for gray marrow, polio meaning gray, and myelos meaning marrow. This timeline continued in 1952 with the epidemic of polio in the United States. And in 1954 is when the vaccine for polio is developed and introduced by Salk and Sabin. In 1979, this was the last reported case of poliomyelitis in the United States. There are still cases occurring in other parts of the world, but our efforts are underway currently to eradicate polio completely. In 1991, paralytic polio is eradicated from the Western Hemisphere. So there has not been a case of polio in the Western Hemisphere that originated in the Western Hemisphere since 1991. So what causes poliomyelitis? Poliovirus is in the family Picornaviridae. It is a virus of the genus Enterovirus. Other enteroviruses include the common cold, pneumonia, aseptic meningitis, and hand, foot, and mouth disease. The species of enterovirus is EVC, which is a non-rhinovirus species of enteroviruses. However, it is commonly just referred to as polio or poliovirus. There are 3 types of poliovirus. These are serotypes. The poliovirus itself is an icosahedral virus that is 25 to 30 nanometers in diameter and has an outer capsid. It is a positive sense single-stranded RNA virus, and here's a little diagram of its structure. The common symptoms and characteristics of poliovirus. Poliovirus is spread via the fecal-oral route. This is the most common way that it is spread. However, it can be spread by droplets as well, such as sneezing or contact with bodily fluids. This method of transmission is much more rare, though. Once the poliovirus enters the patient's system, it lives and replicates in the throat and intestines. And the symptoms and complications, it is 72% of those people who are infected are asymptomatic, and 25% of those who are infected will develop flu-like symptoms. This leaves less than 1% of those infected who actually develop severe symptoms affecting the central nervous system. However, when those severe symptoms develop, they are very severe, and this is symptoms including paresthesia, which is a tingling in your arms and legs, meningitis or inflammation of the brain, and paralysis, which is what polio is historically and commonly known for. This is more common in children under 5 years of age, and it is the most severe symptom that results from polio and can lead to death. We see on the left other common symptoms such as floppy limbs, loss of reflexes, and severe muscle aches. The paralysis can lead to muscle atrophy, and this is where you often see braces used or other therapeutic and orthopedic devices. So now we talk a little bit more in detail about the vaccine itself. There are two types of polio vaccines. There's the oral polio vaccine and the inactivated polio vaccine. The oral polio vaccine is a live attenuated vaccine. So this is a live virus that has been selected to have a reduced likelihood of causing paralytic polio. It can occasionally happen, but we'll talk about that in more detail later on. It produces a local immune response of IgA antibodies in the intestines and gut. It is easy to transport and administer, so it is often used in areas where they are not as developed, since they can send in aid workers to administer these vaccines, and they don't necessarily need trained healthcare professionals. Here we see a little bit more in depth about the antibody response to the polio vaccine, and this is looking specifically at the oral polio vaccine. So this is, you have your T cells and your B cells, which respond to the virus in the gut lumen. For the inactivated polio vaccine, it is an inactivated virus, so it is killed and not alive, so it cannot ever cause an infection with polio. It produces a humoral response with antibodies and stimulates the antibodies to respond. The trivalent version of this vaccine is the only one used in the United States, and it is trivalent because it responds to serotypes 1, 2, and 3 of poliovirus. However, there are some downsides to this vaccine since it is harder to transport and administer, so it is more likely to be used in very well-developed countries and is harder to reach underdeveloped regions. The vaccine schedule for inactivated poliovirus is usually at 2 months of age, you get 1 dose, another dose at 4 months old, another dose at 6 to 18 months old, and a dose at 4 to 6 years old. This can be altered if children are not vaccinated when young, and you sometimes have adults who come into the U.S. and need boosters, or adults at high risk if they are traveling to areas where polio is still endemic. They can receive 1 booster, however, they can only receive 1 booster throughout their life. So 1 booster will cover you for a lifetime. These 3 doses will provide 99% immunity, so that is a very high immunity, and even just 1 dose will cover you up to 90% immunity, but it is recommended to get all 3 doses since that will give you the highest level of immunity. So, eradication efforts. This chart shows that polio is well on its way to being eradicated completely. The numbers in the thousands in 1985 were very high. However, they have trended downwards and are currently very, very low. In the United States, polio has been completely eradicated as of 1979, but we can see by looking at this graph that in the 1950s, when they had the largest outbreak, the case numbers for paralysis were in the up to 15,000. However, after the introduction of the vaccine, it dramatically drops off to only 100 cases that were reported in the 1960s. And this trend continued in the 1970s with only 10 cases being reported, which is a very drastic and steep decline of paralytic polio in the United States. But let's talk a little bit more about how this looks the world over. So eradication worldwide. In 1988, there were 350,000 cases reported of polio. And this is the year when the World Health Organization proposed the eradication of polio. And in 1988, there are countries, it was endemic, polio was endemic in most countries in 1988. However, this number decreased by 99% to there being only 33 cases reported in 2018 and only being endemic in 3 countries. But since 2018, polio has actually been eradicated from the African continent. So the only 2 countries remaining where polio is endemic is Afghanistan and Pakistan. And this is the area that we will continue to zoom in on the next slide. So there are only 2 countries remaining where polio is endemic, and this is the wild type of polio. However, we still are seeing vaccine-associated paralytic polio in Africa, and in scattered cases have been reported in Europe as well. However, they are currently fighting this vaccine-associated paralytic polio by switching from a trivalent oral polio vaccine to a bivalent oral polio vaccine. So this is, they're only including serotypes 1 and 3 in the polio vaccine. And this is because serotype 2 is the one that is most likely to revert to being a contagious and infectious type of polio. So some vaccine controversy. The polio vaccine is safe and effective, as you can see in the headline from the Times Herald in the 1950s when it came out. But they were still advertising a lot in the 1950s to try to encourage people to get vaccinated, since there was some hesitancy. This is because the oral polio vaccine can cause paralytic polio, but it is very, very rare. This is because it is a live attenuated vaccine, so that live virus can actually revert and cause infection. And these strains that have arisen from the polio vaccine can mutate and spread, leading to there being more cases of polio, leading to outbreaks. However, this is very, very rare, and it does not occur with the use of IPV or inactivated polio vaccine. And here are my references, and I look forward to hearing all of your questions. And thank you so much.